Hi, my name is Dr. Cyril Kadam. I am a practicing neuropsychiatrist with a holistic approach using Ayurveda along with yoga and dietary modulations and lifestyle modulations for mental diseases. Let us spare a few minutes to discuss about mental illnesses, which is on a very high, especially after the pandemic, the COVID pandemic. Every other person you see is facing anxiety, facing a fear, unknown fear, having insecurity. The most commonly word used is, I have a lot of tension, I have a lot of stress. So what do? We usually go out for a vacation, we take a day off, and we get back to work. But again, the situation remains the same. So we go for some treatments. So you take some drugs, and again it remains the same. For a few days, when you take the treatment, you're fine. But unfortunately, you may have some side effects of those medications as well. Like your digestive system goes for a toss. If you take it for a long amount of time, probably your weight also increases. And then you tend to not take those medications, and again you land up into square one. So how do you get out of this vicious cycle of overthinking, then tension, then stress? Because your life in your office will remain the same. It is going to continue in the same way. Your life at your home is also going to remain the same. So what is the remedy of this? The remedy is not just medication. It needs a holistic change in your own approach towards your life. At the same time, correction of certain basic humors of your body. Okay, and this correction is required because you have had some faults that were done with respect to your eating habits, with respect to your sleeping habits, with respect to your behavioral aspects. When I say behavioral aspects, it relates to how you interact with people, how is your social connect, what is the way that you treat others, how do you treat yourself in the first place. All of these things put together, they actually create issues like not being able to manage situations, thereby causing more stress. So to decrease the stress means to increase your capability to handle certain situations which are not so comfortable. How do you do that? So there is something in holism which is called as sattva vajay. That is, you need to increase your grit, your mental power to such an extent that petty things do not affect your body's sympathetic system. The sympathetic system, it causes you to give a anger, a loud reaction, shout at people, get disturbed. So you want to calm that thing down. So how would you do that? You want to increase your sattva. That is the ability to control your emotions. How do you control your emotions? First, you need to know where these emotions come from and the link between these emotions and your physical symptoms. So you experience fear, but it's not just fear. What you experience is a palpitation. Okay, your heart throbs like anything. You are sweating. You have sleepless nights. So all this is related to what I just now said as the sympathetic system. What is going to help you control? Well, there is no medication, and whatever medications are there, those are temporary phenomena. They will change the response to a certain extent, but once you stop those medications, again it will remain the same. So you need one correction of the approach towards such situations, which is we call as behavioral therapies. So you have various behavioral therapies, like cognitive behavioral therapy. Then you have REBTs, which is rational emotive behavior therapies. You have something called implementation of emotional intelligence, something called mindfulness. Okay, meditation is too difficult to practice. So I see every other person coming to me saying that I've done meditation, does not help. Well, actually, we don't do it the way it is actually meant to be done, and we likewise do not get those results. We see people saying that I do pranayam, I do yoga, but still it's affecting me. So yoga is something which is a huge discussion, which I'll make another interaction on that. But yoga primarily starts with, so it's Ashtanga yoga, right? So there are 8 components. The first component, and it's a step ladder fashion. The intention of yoga is mukti, right? That is, you actually have a very high threshold towards any pain or any problem that could arise in your daily life. But to reach there, first you have to do yam, niyam, asana. So likewise, other steps. We jump down directly to asana and then we expect. So that's not possible. First we do yam, then yam. That is discipline yourself, educate yourself, which is a part of your CBTs. That is your behavioral therapies, right? So behavioral therapies, along with yoga, along with a change in diet. So you know all the cognition, that is the understanding of situation, understanding the gravity of the situation, understanding or probably registering the severity of any situation, depends on certain secretions of certain neurotransmitters. And these neurotransmitters obviously are related to the sympathetic system, but you have certain neurotransmitters which you can help yourself by eating a proper diet. Like for example, serotonin is a neurotransmitter which is secreted in your stomach most of the time, 90%, but it works across the board, across the body. And you know what, serotonin is not just a hormone or not just an enzyme which is working for your wellness of your brain or your overall mental wellness. It is related to even the sensory aspect. So whatever you have understanding of the situation, serotonin is involved. And serotonin production is primarily based on what you eat. So it is something called tryptophan. If you eat foods which are rich in tryptophan, like seeds, some fruits, you will have a proper amount of serotonin production. And serotonin is also related to the same pathway is also related to production of dopamine, again which is a feel good hormone, again which is a rewarding hormone, a happy hormone. So these things are interrelated. So what you need is, as I said, your behavioral therapy, second is diet, and third is obviously you have a change in the constitution of your mind. Mind has three qualities. Okay, the primary the twos are the rajo and tamas gun, and this is regulated by a superior authority called the sattva. And we just not talk that we'll increase our sattva, we'll manage our sattva in such a manner that these raja and tama do not go haywire. Now this raja and tama needs to be corrected. So diet will take care of it, your behavioral therapy will take care of it, your mindfulness will take care of it. But because of this, and because of your faulty eating habits, your insults to your physique that you have done already, you need to change even the metabolism of your body. And that requires something called Shodhana or Panchakarma. So it is correction of your humors of your body, which is primarily related to the gut. Okay. However important, you must have heard, the gut is probably 10 times is what is the importance of your gut health to your mental health. So you need Panchakarma if it is too bad, otherwise medications would do. Having a group of probiotics in your meals, if you are having some problems right now, inclusion of prebiotics in your meals, probiotics as medications will help you. Medications in a sense, supplements will help you. But make sure that you have a holistic approach. Holistic in a sense, you know the root cause, or you try to track the root cause and then work out. Don't take symptomatic medications and don't do self-medication. Any medication that you are using, which is a chemical, it will go through your liver, it will go through your excretory system, it will do certain harm. We don't want that thing as well. So make sure that you consult a right person. Make sure that you use as much as natural therapies to get back to normal. And I'll tell you, I can assure you, unless and until it is genetic in origin, unless and until it is too bad and pretty much neglected, you can easily treat your mental illnesses with a holistic approach. If you need any help, call me. Okay, the number will flash in this video. Thanks a lot and have a very, very, very healthy life.